treat. Medical intervention can help prevent a bad health situation from getting worse. Here now to discuss that is Dr. Nicholas Verdura, Medical Director of Hartford HealthCare's Advanced Wound Care Centers in New Britain and Bristol. Doctor, welcome.
Good afternoon. Thank you very much for having me. It's a pleasure to be here.
Oh, it's our pleasure. So explain the conditions that need to be treated and when a person would know that it's time for them to see a doctor.
So we see patients here at the Wound Center that may have diabetic, venous or arterial ulcers, pressure injuries, non-healing surgical wounds, tissue damage from radiation, osteomyelitis, which is a bone infection, or burns. If a patient has had this wound for about 2 weeks with no signs of healing or not completely healed in 6 weeks, they would absolutely be a candidate to come see us at the Wound Center.
All right, doctor, what are some of the treatment options for someone who has had a wound that's not healing? I see you're in front of some equipment there, high tech.
Yes. So everyone is different, and we would evaluate each patient individually and tailor a treatment regimen for them accordingly. There are various treatment options that we can utilize, including debridement, which is removing damaged tissue from the wound bed. We can customize wound care dressings, utilize skin substitutes, as well as hyperbaric oxygen therapy. We participate and compare ourselves to a nationwide database of patient outcomes for wound healing to ensure that we are constantly improving and staying on the cutting edge.
All right, you mentioned hyperbaric oxygen therapy. So how exactly does that work? We've heard of it, but we may not understand it.
So yeah, that's an excellent treatment option that we have. This therapy helps wounds to heal by supplying oxygen-rich plasma directly to the tissue in a wound that's starving for oxygen. As a result, this encourages new collagen, blood vessel formation, along with skin cells to grow. Behind me is one of the hyperbaric oxygen chambers that we have, in which patients are able to come in, have their treatment done all the while watching TV or their favorite movie.
All right, what often happens to people who ignore their wounds and don't seek treatment?
So chronic wounds can lead to amputations, and this contributes to a major portion of the death rate here in the United States, which is on par with many cancer diagnoses. So delaying treatment is one of the worst things that a patient can do. We effectively heal over 90% of our patients with various advanced wound care treatment options that we have, and we've won numerous accolades, including Center of Excellence for our healing rates and our metrics. So anyone who is in need of medical attention for a chronic wound that is failing to heal, they can absolutely give us a call, and we would be happy to help them and look forward to treating them.
All right, and of course we have that new information on the screen, Hartford HealthCare. You can find more. Dr. Nicholas Verdura with Hartford HealthCare Wound Care Centers, thank you so much for joining us.